866. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the You and Your Doctor show for Friday, July 13th. Wow, it's hard to believe that we're already here halfway through July already. Tonight, we're going to be talking a lot about cardiology. We have Dr. Ida Mazza on the program. She's a cardiologist with Tenet Florida Cardiovascular Care in West Palm Beach. So without further ado, I want to welcome to the program Dr. Mazza. How are you doing this afternoon?
Very good. Thank you. Good evening, everybody.
Thank you, and thank you for joining us. I always say on this adventure of health because we learn so much on this show. Now, you were fellowship trained in non-invasive cardiology, which I don't know much about with the non-invasive term. I just want to share, is it correct you did your fellowship at Albert Einstein Medical Center in Philadelphia in non-invasive cardiovascular medicine? Very prestigious institution there.
Yes, thank you. Non-invasive cardiology. So I see cardiologists like, almost daily life. There are some electricians, which are the cardiologists that take care of arrhythmias and put pacemakers. They are the plumbers, which are the interventional cardiologists who do catheterizations. They are the photographers, which are the nuclear cardiology, echocardiographers, which is what I am. So non-invasive means that we create diagnosis using non-invasive techniques, like echocardiography, stress test, steel table test, electrocardiogram, monitors, that type of thing. So that's a non-invasive cardiologist, specialist in diagnosis.
That's a great explanation because, I've never had that explanation. And, we've had a cardiac electrophysiologist on this program, like you mentioned, electricians of the heart.
Correct.
And interventional cardiologists. But, now today and age, there's so many different medical specialties and fields, but that's great for the individual, the patient and the community as well. So thank you for explaining that. Now, your office is in West Palm Beach. Tell us about what age range of patients do you see as a cardiologist?
Basically, everybody that is over 18 years old, because I am not a pediatrician. From there on, everybody. Cardiovascular diseases can be seen from children all the way to very advanced ages. We, the non-invasive adult cardiologists, see everything from 18 and over.
Okay. Well, that's great to know as well. And your office is at 1411 North Flagler Drive, Suite 8000 in West Palm Beach, which I'll give that out a few different times in the program. One of the things I always like to ask cardiologists, if I have on this show cardiac electrophysiologists or even interventional cardiologists, even if we have a cardiothoracic surgeon, because there's so many different tools to treat it nowadays, is atrial fibrillation. To be honest with you, I didn't even know what it was 5 years ago before I got into healthcare PR, as everyone knows that that's my job here. So tell me a little bit about atrial fibrillation and why is it so common all of a sudden, and why is it always in the news, and what kind of ailment is it?
Well, it's not that it's all of the sudden. We are recognizing it more and more. It's becoming epidemic. There is close to 2.8 to 3 million people in the United States affected by atrial fibrillation. It's a very common arrhythmia, the most common arrhythmia, multiple different causes. And what happened, you have to see the house as an upper level and a lower level.
Okay.
And the blood usually goes from the upper level to the lower level and then outside to the body. For some reason, there is a lack of the normal contraction of the upper part of the heart, which start having irregular electric activation. So if you see a heart, normally beats up and down, up and down. The atrial fibrillation, the upper part gets lost, start shaking. That's what is called fibrillation. So there are two main problems with atrial fibrillation. One of them is when you have the upper part shaking fast. Just remember, both parts of the heart are supposed to work together. The lower part can try to follow the upper part of the heart. So you can have the problem of getting very fast. A heart beating very fast can suffer from lack of oxygen, can fail. So you can have heart attacks, heart failure, multiple problems just by the speed of contraction of the lower part of the heart. The other problem with atrial fibrillation, which is the real health problem, is that about 15 to 25% of the strokes, major strokes, are related to atrial fibrillation. Why? Because when you're shaking the heart, you're not really moving the blood efficaciously. So you can form blood clots. And then blood clots out of the heart go to the brain. So atrial fibrillation is really a society problem. It's a health problem that is in the rise.
That's interesting to hear. We think of stroke as a brain attack, kind of like a heart attack, but for the brain. And when those blood clots form and they travel towards the brain, that can cause a whole lot of different problems and stroke as well. So atrial fibrillation can be tied into stroke. 15 to 20%, you said.
15 to 20%, and
Okay.
the incidence increase with age. It's expected that approximately 8% of the people more than 65 years old have atrial fibrillation, 10% in patients more than 75 years old. And this is a worldwide phenomenon. In Europe, there is approximately 30 million people affected by atrial fibrillation right now, and it's on the rise.
Unbelievable. And tell me a little bit about the symptoms, because I've heard a patient describe their atrial fibrillation as almost like they had when it comes on, like they had a bird in their chest, like flapping its wings. But then I've talked to patients who have never even had a symptom, didn't even know, went to their doctor for a checkup, maybe their primary care, was sent to a cardiologist, and all of a sudden, you have atrial fibrillation, we need to take care of this. Tell me a little bit, is it symptomatic in most cases, or can it be non-symptomatic as well?
There is a great percent of patients that are completely asymptomatic, and that is the sad part. Many times we just discover when the patient gets a stroke. The ones that have symptoms can be like palpitation, shortness of breath, symptoms of chest pain. Some people describe as fluttering on the chest. It's very, very personal. But palpitations is the most common one.
Okay. And can it be treated by medicine, or in some cases, do you have to have like a interventional procedure or a surgery?
Like everything in medicine, we usually start with a simple plan, which usually we start with medications to try to control the speed of the heart or the rhythm of the heart. When this approach fails, we have things like ablations, which are techniques in which the electrophysiologists put electric catheters in the heart, trying to freeze the tissue where the atrial fibrillation originates. And very much as a last resources, then there are other type of ablation that requires pacemaker. In all the cases, and depending on the risk factor of the patient, anticoagulation, so making the blood thin to prevent blood clot formation.
Mm-hmm. So, what we know as blood thinners.
Correct.
Okay. Do they know if AFib is a genetic disease, or is it too early to tell? I mean,
well, no. There are some studies in which there is something called familial atrial fibrillation. They're working on some genes. It's about 30% of the cases of atrial fibrillation may be familial. There's it's a collection of different genes that they're investigating right now. But most of the atrial fibrillation, 70% of the fibrillation, has risk factors like hypertension, diabetes, obstructive sleep apnea, etc., etc.
Can it be prevented? Like, is there something I can be doing in my daily activity to make sure that I don't get it, or is it something that, it could come on? You just have to be going to your primary care or cardiologist, whatever time frame you need to be seeing them for.
Well, as I told you, 70% is it takes part of those lifestyle diseases in which hypertension, diabetes, obesity, lack of exercise, sleep apnea can be an increased risk for atrial fibrillation. So in all of the cardiovascular diseases, if we control this group of risk factors, we are preventing. Can atrial fibrillation be completely prevented? No. I have had cases of patients completely healthy otherwise presenting with atrial fibrillation. So it's a matter of having a low threshold to suspect it, follow with your primary physician, prevent the regular risk factors for heart disease, and that's what we have so far.
Great to know. Great. Very knowledgeable. Thank you for explaining that. We're here with Dr. Ida Mazza. She's a cardiologist with Tenet Florida Cardiovascular Care. Her office is at 1411 North Flagler Drive, Suite 8000, West Palm Beach. You can check out her website on tfpsdocs.com. That's tfpsdocs.com, where all your information is there. You're a board certified physician, which is great. I have right here American Board of Internal Medicine. Dr. Mazza is board certified in cardiovascular disease, which is fantastic to know. So check out her website, tfpsdocs.com. Her number's 561-655-1318, and I'll give out that info a couple other times. Now, I also wanted to talk to you a little bit about cardiomyopathy, but because I actually was reading an article about a football player who it was discovered that he had a heart condition and that it could maybe lead to that. So what is cardiomyopathy?
Well, cardiomyopathy is the general term that describes disease of the muscle of the heart.
Okay.
Myopathy, the myocardium, the muscle of the heart. So it can be disease caused by hypertension, which is the hypertensive cardiomyopathy. In athletes, there are some genetic diseases like hypertrophic cardiomyopathy, which is the most common cause of death in athletes when they drop dead on the field. And cardiomyopathy can be because of lack of oxygen on the heart, like ischemic lack of oxygen, cardiomyopathy. So everything that is a disease of the muscle is a cardiomyopathy.
Okay. How does a cardiologist find out if someone has cardiomyopathy?
Well, you start with cardiologists like me, which are the non-invasive cardiologists. We do tests like electrocardiogram, which tests the electricity. Echocardiograms, which are sonograms of the heart, which are the first line of diagnostic techniques. Tell us about the size of the heart, the strength of the heart, the thickness. If you have abnormalities on an echo, then you start suspecting you diagnose the cardiomyopathy and start the workup in more complex techniques.
Now, another one of your areas of interest is in heart failure, and then the management and prevention. Tell us a little bit about heart failure and that management and prevention as well.
Well, heart failure is such a complex problem. You know how before we used to say that people die from heart attack? Now we have advanced cardiology so much that people is not dying from heart attacks, from heart failure. And heart failure is the same as atrial fibrillation. It's a combination of lifestyle plus diseases that affect the heart. So what is heart failure? It's when the heart cannot meet the requirements of what your body needs. Remember, the heart is the pump that sends the oxygen to everything, our ears, our toes, our stomach, everywhere. When the heart cannot meet that demand, comes what is called a heart failure. There are two main types. One is when the heart is so weakened by a cardiomyopathy, for example, or when the heart is normal in function, but is very stiff. It can beat out the blood, but it's very stiff. It's called diastolic heart failure. The heart can fail in the right side or it can fail in the left side. So it can be right-sided heart failure, left-sided heart failure. So when the body needs oxygen and the heart cannot give it, that's what we call heart failure. The symptoms are complex. The most common one is shortness of breath. Shortness of breath when you walk, when you get dressed, when you climb stairs, swelling of your legs. Shortness of breath waking up patients from sleep, or when you cannot lay flat in your bed and you need 6 pillows because you cannot lay flat, you're very short of breath. So it's a variety of symptoms. It's the most common problem with cardiologists see together with atrial fibrillation. And it's a society problem. It's one of the most common causes of hospitalization, rehospitalization, spend of Medicare dollars. So it's a real disease,
Now, you mentioned also that diseases can lead to heart failure.
Yes.
We talk a lot on the show. I have a lot of pulmonologists on the show as well. So we talk a lot about COPD or chronic obstructive pulmonary disease. Is that something that could even lead to heart failure as well?
Oh, yes. Just remember, the lungs and the heart, I see them like husband and wife. They're connected. They work together. Their function is to put oxygen from the air to the body. And the lungs are the entry point of the oxygen. So when you start having COPD, emphysema, because of smoking, it's a smoking disease, so the heart can start having right-sided heart failure, arrhythmias like atrial fibrillation, more complex arrhythmias, heart attacks. So yes, lung disease and heart disease are interlinked.
Dr. Mazza, hold that thought. We're going to take a quick commercial break, and on the other side, talk about more complex cardiac conditions on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments and my curveball question of the hobbies and passions in life doctors pursue when not providing medicine. And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. And we're back. Thanks for joining us. We're here with Dr. Ida Mazza. She's a cardiologist with Tenet Florida Cardiovascular Care in West Palm Beach. Tell everyone what hospital you're on staff at there in West Palm Beach.
I'm currently at Good Samaritan Medical Center in West Palm Beach.
Oh, nice.
My office is just at the building in the side of the hospital.
Right on the campus there.
Right on the campus, yes.
And the Victor Ferris building, which is a beautiful building.
Yes, it
as
is.
well. And the address is 1411 North Flagler Drive, Suite 8000, downtown West Palm Beach. You're telling me it's on the 8th floor, so even some of the rooms overlook the Intercoastal and Atlantic Ocean.
Which is good for the heart, good for the spirit.
Yeah, it makes you happy. So that's really neat to see. So she's a great cardiologist, Dr. Ida Mazza, very experienced, very knowledgeable. One of the things I want to talk about as well on the show, we already talked about heart failure, atrial fibrillation, which seems to be a really big thing in the U.S. and the world. You said as well. We talked a little bit about non-invasive cardiovascular medicine. That's mostly what you specialize in, but coronary artery disease, what is it, and what are the ways what are the symptoms, and what are the ways it can be prevented?
Well, I can give you a professional lecture on what it is, but I'm going to give you a normal life explanation of what it is. So let's suppose we have 100,000 people that lives in West Palm Beach.
Okay.
And they work here in Boca Raton, right? And they have to go home at 5 p.m. So they have I-95, US 1, and Turnpike, right?
Correct.
So the people are the molecules of oxygen that are going to go to their houses, which is the muscle of the heart in West Palm Beach. The highways are the coronary arteries. So if you get a big traffic accident in I-95, you're getting an obstruction of the flow to West Palm Beach. So coronary artery disease is when you have obstruction of the flow in the coronary arteries, which are nothing else than highways that take the oxygen to the entire heart muscle. And is one of the most, let's be clear, is the #1 cause of death worldwide in the advanced world. Yes.
So anytime there's a blockage, I mean, that's...
Yes, that obstructs the circulation to the muscle of the heart. So, yes.
Now, we hear about blockages, again, if I'm interviewing a patient for a testimonial or talking to them as well, sometimes I hear, the doctor said it was 90% blocked or 98% blocked as well. So is there any way of knowing, are there any symptoms that a patient or individual may feel beforehand and say maybe it's time to talk to a family member, hey, man, I need to go to the hospital, or I need to go see a doctor?
Absolutely. Most of the coronary artery disease events have some symptoms. The most common symptom, particularly on men, tend to be the retrosternal, the center chest pressure, mostly when you are physically active, because remember, the heart is working when you are doing nothing. and it's requiring some amount of oxygen. But now if you exercise and you're asking more from the heart, that's when the problems start coming, when you start having blockages. So chest pain or pressure, shortness of breath during physical activity, that's the key point. When you're demanding more of the heart and you're getting not what you need, then you can have the pain on the chest, shortness of breath, fainting. Those symptoms are much more concerning. In women, which it's also a real important point, because women, we suffer from heart disease as well, indigestion symptoms. Sometimes women and men, the symptoms are pain in the neck, pain that goes to the arm. Shortness of breath is a common symptom of coronary artery disease. So everything that bothers you in the chest or the breathing that is related to physical activity should prompt a visit to your doctor.
And again, is that management for coronary artery disease? Does it, you have a whole toolbox of tools to work with. So does it start, like you said before, with maybe a medication, and then if that maybe doesn't work, maybe on to a surgical option?
Correct. You usually start with medical management of the risk factors like the blood pressure, the cholesterol. If you smoke, stop smoking. If you're diabetic, control your diabetes. Blood thinners like an aspirin. When the disease has advanced too much and you're having too much symptoms, we do diagnostic techniques, which could be the stress test, cardiac catheterization. When the obstructions are significant, 70, 80, 90%, we'll do what is called angioplasty, in which you put a balloon, open the obstruction. When the disease is widespread in all the blood vessels, we do what is called bypasses, which, is surgically constructed highways bypassing the obstructions. So yes, the therapeutic armamentarium goes from simple aspirin all the way to bypass and multiple other tests in between.
A lot of different tools in the cardiologist toolbox. We're here with Dr. Ida Mazza. She's a cardiologist with Tennant, Florida Cardiovascular Care, right around the corner in West Palm Beach. On staff at Good Samaritan Medical Center. Great hospital, by the way. My daughter was born there. My wife was born there, and my sister was born there. So nothing but great things. All the ladies in my life there were born there. 1411 North Flagler Drive is Dr. Ida Mazza's address. It's Suite 8000 right there in the Victor Ferris building. Now, you're bilingual, so tell us. You can speak English and Spanish as well.
I can speak English.
Oh, and limited Italian. Didn't I see that?
Sure.
Okay, trilingual.
Speak English, Spanish, and I understand Italian very well.
Okay.
I'm a little bit of ashamed of speaking Italian, but I can understand it.
You can understand it, though. Good to know.
When I was in Pennsylvania, I used to have Portuguese patients, and I could understand them. So I love trying to understand people. In some way, we make each other understand.
Well, that's good to know. We're here in South Florida, so it's good definitely to have a cardiologist, who can communicate in several different languages. I wanted to ask you, why did you become a cardiologist? Why did you decide? Because you went through residency. It was also at Albert Einstein Medical Center in Philadelphia in internal medicine, but there's all different options for doctors, so what was the thing?
Yes, well, when I was in medical school, I was interested in everything. But when you start seeing patients dying from heart disease, arrhythmias, dilated heart, it's really, really striking. For me, that was an eye-opening. Then trying to understand the way the heart works. So I completely fell in love with heart disease, and it has become my life. So, when you are in medical school, there is always that little thing that wakes you up, and it says, this is where my heart goes. And that's what happened to me.
Because when for someone who hasn't gone through it, we always like to, this is fascinating to people who aren't doctors. When you're a resident, you go on rotations into all different departments. Is that correct?
That is correct. I remember in medical school, I remember doing the rotation in orthopedics. And, the bones were nothing that really attracted me.
Yeah, that wasn't your thing.
Definitely not. And you do surgery, and you do gastroenterology, you do everything. You
neurology too?
Get exposed to everything. Oh, yes. And for me, the exposure to, by the way, heart and brain, because they're also very interlinked together.
Just like the lungs and brain are, the heart and brain. Yeah.
Exactly. So that's what, opened my eyes and my love to this field.
Yeah, I don't always think of that. So Albert Einstein Medical Center, that's in Philadelphia, busy hospital?
Very.
So
very busy.
In the downtown area?
Yes,
okay.
Just north of downtown in Broad Street.
I haven't been to Philadelphia yet, but it's on my list. I definitely want to check it out. That's great. Now, I always like to ask doctors on the show, what are your hobbies in life and outside of medicine? I know you're a very busy cardiologist, but...
Well, life is only one. You have to live it to the fullest. So if you want to know about my loves after medicine, you need a whole program for me on that. Well, one of my biggest passion after medicine, of course, my daughter is, nature, environment, conservation. I love the ocean with total passion. I'm a scuba diver. I like to take pictures, respect nature. I love life in general. So
nice, a scuba diver. Wow, you're in the spot for scuba diving. Have you had a chance to get out off Palm Beach?
First class.
Oh, nice.
Palm Beach diving, yes.
Have you scuba dived other places in the world as well?
Yes, I have.
Oh, nice.
I have traveled around, I'm telling you. You need a whole program for me on that one.
Nice. And you also said music, art, and photography as well.
Yes, correct. I'm the type of passionate person that, things get to my soul. That's one of the things I like on photography. If I see something, I like to, keep that vision, that sensation that comes on me. That's where photography comes. Music, I think, is the universal language. I think music goes to every corner of the planet, every soul. And art, I mean, it's one of the beautiful things that we humans can create. We are not destroyers. We are creators, and art is that.
Definitely. Yeah, one of the things I do on the side is I play guitar, so that's my hobbies and passions outside of being a radio host and a PR guy for a healthcare company. But thank you so much for joining us on the program. We have to have you on again. You're so knowledgeable on every subject. So
thank you.
So check Dr. Ida Mazza out, cardiologist with Tenet Florida Cardiovascular Care, 1411 North Flagler Drive, Suite 8000, West Palm Beach. 561-655-1318 is her number. And if you miss any of this information, check out tfpsdocs.com. She has a cardiology profile there. That's tfpsdocs.com. Thank you and have a good evening. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.